Definition of vitamin D deficiency. The most stable and abundant metabolite of vitamin D in human serum is 25-hydroxyvitamin D. It has a half-life of about 3 weeks, making it the most suitable indicator of vitamin D status. If 25-hydroxyvitamin D is less than 10 nanograms per milliliter, then it is considered deficient. Around 11 to 20 nanograms per milliliter is insufficient, and more than 20 nanograms per milliliter is optimal. Vitamin D is an incredibly important vitamin that has powerful effects on several systems throughout the body. Unlike a lot of vitamins, vitamin D really works like a hormone. Every single cell in your body has a receptor for it. Your body makes it from cholesterol when your skin is exposed to sunlight. It's additionally found in certain foods such as fish oil and also fortified milk products. These are common risk factors for vitamin D shortage. Being senior, not consuming much fish or milk, living far from the equator where there is little sun year-round, always utilizing sunblock when going out, remaining indoors. The majority of people don't understand that they lack vitamin D, due to the fact that the symptoms are usually subtle. Here are 8 symptoms and signs of vitamin D shortage. Number 1. Getting sick or infected frequently. One of vitamin D's essential role is maintaining your immune system robust. You're able to prevent infections as well as bacteria that cause infection. If you end up being sick often, specifically with colds or the influenza, a low vitamin D level might be a cause. Number 2. Fatigue and tiredness. Feeling exhausted can have several causes, and vitamin D shortage might be one of them. Sadly, it's usually overlooked as a possible cause. An observational research study of women registered nurses discovered a solid connection between reduced vitamin D levels and self-reported fatigue. Number 3. Bone and back pain. Vitamin D is responsible for keeping bone health and wellness by a number of mechanisms. It boosts your body's capability to absorb calcium. Large empirical researches have found a relationship in between a shortage of vitamin D and chronic lower back pain. Number 4. Impaired wound recovery. Slow recovery of wounds after surgery or injury may be an indication that vitamin D levels are too low. Results from a test tube study suggest that vitamin D boosts the production of compounds that are essential for forming brand new skin as component of the wound healing process. One study on patients that had oral surgery found that certain facets of recovery were hampered by vitamin D shortage. It's been observed that vitamin D's ability in managing inflammation and also combating infection is essential for correct recovery. Number 5. Bone loss. Vitamin D plays an important role in calcium absorption and also bone metabolic process. Here vitamin K2 plays a very important role by directing calcium away from soft tissues. Vitamin K2 prevents calcification and hardening of arteries. Female patient diagnosed with bone loss may believe more calcium is needed, but in fact, they may be lacking in vitamin D. Low bone density is and signifies that calcium as well as other minerals have been shed from bone. This places older people, particularly women, at a higher risk of fractures. Ingesting sufficient amount of vitamin D is important for maintaining bone mass as age. Number 6. Loss of hair. Loss of hair is usually attributed to stress, which is definitely a typical cause. However, when hair loss is severe, it may be the result of an illness or nutrient shortage. Hair loss in women has actually been connected to reduced vitamin D levels in body. So far, hair loss may be a sign of vitamin D shortage in female pattern baldness. Number 7. Muscular tissue pain. The sources of muscular tissue pain are usually difficult to determine. There is some evidence that vitamin D shortage may be a probable source of muscle pain in children as well as adults. Number 8. Depression. A depressed state of mind may also suggest shortage of vitamin D. In scientific literature review studies, scientists have linked vitamin D shortage to depression, particularly in older adults.